produtores de vacina.
Today, we are vaccines producers within our national territory. Even more, we will manufacture the active pharmaceutical ingredient that is the necessary raw material, and in a few months we will be self-sufficient in terms of vaccine production. We do not know for how long we will have to face this disease, but national production will guarantee that we can vaccinate all Brazilians of all ages, regardless of the variants that may arise.
Let's go to Sao Paulo and speak to the journalists Jennifer and Thomas. Jennifer, Sao Paulo, Brazil's biggest city. What's the situation there?
Hi, thank you for having me here. It's very dramatic. I think that's a word that might come down to what we're going through here. Things aren't getting any better. They're just getting worse and worse, and we don't really see when things will take a different turn.
Brazil has reached an agreement with a few countries to produce vaccines produced abroad, but it seems as if there's a problem with the rollout and the number of people who are being injected. Is there also a lot of vaccine hesitancy, especially given that Bolsonaro himself has said, I'm not going to have an injection?
Yes, that is a great object of concern right now. We're still going through the majority public, the elderlies and health workers, and starting to think about other groups. But even though Bolsonaro says he won't, or he hasn't still said that he will get his vaccine, we know that his mother has been vaccinated, so there is a difference, a slight difference between his speech and what actually happens in practice. But it is a motive of anxiety about how many doses we actually have, when they will arrive, and when we will have actual mass vaccination in Brazil.
Is there still an argument going on between the federal government and state governors about lockdowns and when businesses should be reopening? And what about these protests that we're talking about, people not happy with lockdowns?
Yes, it took a political turn between the governor of Sao Paulo, for instance, and the federal governor. So a true hard lockdown hasn't really happened. We have a few cities who put that in practice and which had good results, if we've seen in other countries. So in those places, contamination has gone down. And so it's a mess. Like you have a social problem, you have an economic problem, and you don't really solve the health problem. And so these protests, we need a national coordinated system which will actually organize everything that's going on.
Have you been able to possibly see for yourself what the situation is like in healthcare facilities around Sao Paulo? I mean, even if not, what's it like going out onto the streets of the city? Do you feel the tension amongst people? Because obviously there'll be different opinions about whether people should be allowed to live freely and take their own risks with the vaccine, and those who say, no, we really need to have impositions placed upon us to keep us all safe.
Yes, you have different positions, and it's our social inequalities. That's a really big problem in Brazil. So it really depends on who you're talking to and which sort of you're dealing with. So it is a tense moment. There is an economic crisis. People do need to get vaccinated, and it is still a tense moment, and with hospitals getting fuller by each day and each week.
Yeah, absolutely. And of course, I meant living with the virus, not living with the vaccine. OK, Jennifer and Thomas in Sao Paulo, thank you so much indeed, Jennifer. Stay safe.